I do have a history of breast cancer in my family.
If a lady rings up and says she's got a breast symptom, I will ring her back that same day. I don't want to delay anything.
How do we check them?
I would say start at the nipple area.
What exactly is a dense breast?
Drinking a little bit of alcohol a week or obesity are much bigger risk factors than...
You blow my mind. Welcome to No Appointment Necessary. My name is Cherry Healey.
And I am Dr. Amir Khan. I am usually at my GP surgery up in Bradford, but you can find me here alongside Cherry on this podcast, No Appointment Necessary.
Can you imagine missing an episode of this? Well, you don't have to because you just need to subscribe. That's it.
Yeah, please do. And you can also join our Facebook community. There are over 16,000 community members on Facebook now, which is incredible. We love you all. If you haven't joined already, please do just search for No Appointment Necessary.
Today, we're talking about all things breast related and how you need to know what's normal for you. For this episode, we're brought to you in partnership with Randox Health and their Everyman and Everywoman health checks. What are they, Dr. Amir?
The Randox Health Everyman and Everywoman check measures up to 150 biomarkers, giving you a complete picture of how your body's really doing. Regular blood testing is one of the best ways to spot potential risks early, so you can make changes that support your long-term health. And they're quick to do. You'll even get a follow-up test 6 months later, so you can track your progress and see the difference your lifestyle changes are making. And for this, you don't need to see me because there's no GP referral necessary.
You will get your results in just 2 hours from the test hitting the lab. And good news, if you use the code NAN15, you can save 15% on your Everyman or Everywoman health check until the 27th of January. All you need to do is go to randoxhealth.com. If you're listening to this at the start of the year, you might be thinking about getting back into an exercise routine.
And regular exercise, especially something like running, one of my favourites, is one of the best things you can do for both your physical and mental health.
Which is why now is the time people start thinking about marathon training. If you've got a ballot place for the TCS London Marathon, there's a really meaningful way you can do it.
And that is by joining Team Marie Curie. Marie Curie supports people at the end of life, whatever the illness. And they also support families and loved ones through grief. And I can speak from experience because they have looked after my patients in the past.
Really? So you know. So many people take up running after losing someone, whether it's to honour them or to help them cope. So why not join Marie Curie?
There's no fundraising target. You get brilliant support with access to an in-person training day with a Team GB coach, a limited edition Marie Curie New Balance top, and post-race, I think I might just join for this, a free massage and well-deserved drink.
Do you think that's incredible?
Yeah.
Hang on, can we just have a minute? A Team GB coach, a free massage.
And a vest.
A drink, a vest, and all the support.
That is worth it.
It's very good, isn't it? To find out more, search Marie Curie London Marathon and see how they'll support you every step of the way. This week's check-in is all about breasts. So, what is a boob? And why is it so linked with cancer? Why do we get breast cancer?
Yeah, I think that's a question that nobody really asks. So breast tissue itself is made up of lots of different things. Yes, there's fat cells in there, but there's also glandular and hormonally active cells. So it's a collection of different types of cells and tissue. And what's really important is, yes, women have them, but men have breast tissue too, particularly under the nipple area.
Men get breast cancer?
Men can get breast cancer. Yeah, there's about 400 cases in the UK of male breast cancer a year. Obviously, the vast majority are in women, but men should be aware of the symptoms as well.
They're quite complicated. They do lots of things. You know, they grow during puberty, so obviously hugely affected by hormones. Obviously, they feed your baby.
Yeah.
They look fab sometimes, depending on what you're wearing, what your outfit is. You know, they perform quite a complicated function.
Yeah, and that is part of the reason that they are at risk of cancer, because they are constantly changing. The cells are constantly growing and dividing, and they're also hormonally active. So all of those things, they change during puberty, they change during your period cycle, they change during and after the menopause, pregnancy, all of those things cause breast tissue to change. And anything that causes cells to divide more rapidly, which growth does, hormones, particularly estrogen, can do that as well, increases a risk of a mutation taking place as that cell divides. So what happens in cell division is that the cell copies itself essentially and creates two of the same thing. During that copying process, a mutation or an error can take place within the DNA, and that error is what can lead to cancer, which is why breasts are so at risk of cancer, because they're changing all the time.
At what stage of life are women most at risk of developing breast cancer?
Women can develop breast cancer at any age, but it is more common the older you get. So age itself is a risk factor. The longer you've been exposed to hormones, particularly estrogen, is a risk factor. So that goes along with age. Genetics plays a big part as well. If you've got a first-degree relative or two second-degree relatives with breast cancer, particularly under the age of 60, that is a risk factor. If you've got a man with breast cancer in your family, that significantly increases your risk as well.
Why?
Because it's so unusual for men to get breast cancer, there is very likely to be a genetic link in there somewhere, rather than all the other things that increase women's risk of breast cancer. So things like hormones don't necessarily play the same part they do in men. The other thing to bear in mind is obesity, alcohol, smoking, all of those things increase your risk of breast cancer.
Why does obesity increase your risk of breast cancer? That seems a weird link.
So fat cells, well, people think about fat cells, they think of them just sitting there doing nothing. Fat cells are actually very metabolically active, and that can be harmful. They can release hormones, including estrogen. So high levels of estrogen over a long period of time. You're looking really...
You blow my mind.
Fat cells release estrogen.
Estrogen?
Yeah, totally.
What?
So they can release hormones that increase your risk of breast cancer, including estrogen. But the other thing fat cells do is release chemicals that cause cell division. So we call them growth factors, essentially. So they're releasing these chemicals called growth factors. They float around your body, increase the rate at which cells divide. If cells are dividing at a higher rate, there is a much higher chance of an error taking place, and that can then lead to cancer. So fat cells are not sitting there doing nothing. They're doing lots of harmful things, which is why being obese is a risk factor for many cancers.
Why does alcohol increase your risk?
So alcohol's really interesting because even small levels of alcohol in your blood can increase the amount of estrogen that you produce.
So alcohol encourages the production of estrogen in your body?
Yeah, and it doesn't stop there either. So when we break down alcohol, we break it down into acetaldehyde, which is a carcinogen. That can damage your DNA, and that damage to the DNA can increase your risk of cancer. The other thing alcohol can do is reduce the amount of folic acid you absorb from your diet. And folic acid is really important in cell repair. So damage that's being done from day-to-day wear and tear, folic acid is really good at helping that damage get repaired. If that isn't happening, that damage can then lead to a cancer. So alcohol is a big, big risk factor in breast cancer.
Does obesity and alcohol, those factors like that, does that affect all cancers?
It's difficult to say all cancers, but they certainly do increase your risk of a lot of the common cancers, like bowel cancer, like prostate cancer, breast cancer. So those kind of cancers that we're seeing a lot more of, alcohol, obesity, the food that you eat play a big part in that.
As we get older, our estrogen depletes as we hit perimenopause and then menopause. Surely that's a good thing. We're less at risk if estrogen and cancer are linked.
You'd think so, but breast cancer is linked to lifetime exposure of estrogen. So it's not what your estrogen's doing at that particular time. So women who have had an early period and a late menopause have had a much longer exposure to estrogen, and it's that increases risk. Breastfeeding suppresses estrogen, so actually reduces your risk of breast cancer overall. So it's all about lifetime exposure to estrogen and progesterone.
But when you hit perimenopause, you might want to start taking HRT, which is estrogen.
Yeah.
Is that a bad thing?
So this is really interesting because I think HRT and breast cancer are slightly misunderstood. So with HRT, actually, women who've had their womb taken out will only be given estrogen because they don't need the progesterone to protect them against womb cancer or endometrial cancer. There's actually evidence that will reduce your risk of breast cancer overall and protects you against breast cancer. It's the combination HRT that women are given when they have a womb, so estrogen and progesterone, that can very, very slightly increase your risk. However, and this is really interesting and really important, with newer versions of progesterone, what we call body-identical progesterone, which is very, very, very similar to the progesterone women would naturally make themselves. Now, combined HRT generally has estrogen and body-identical progesterone. There's very little or no risk associated with that with breast cancer. It was the synthetic progesterones that we used to use where there was a slight risk. To put that into perspective, drinking a little bit of alcohol a week or obesity are much bigger risk factors than HRT has ever been.
So that fear factor about going on to HRT, we don't need to worry about that anymore.
The only thing I would say is that if you have had breast cancer or if you have a very strong family history of breast cancer, speak to a specialist about it because your risk might be slightly different to someone who hasn't got those risk factors.
Okay, so let's go back to basics. How do we look after our breasts? How do we check them? I have to admit, I find checking them really scary. I've got very dense breasts.
Yeah.
You know, they're not the cleverest breasts in the room.
Dense breasts are really common. Half of women have dense breasts.
Really? So
yeah.
I find it scary to check my breasts sometimes because I almost always find something.
Yeah.
But I often get my GP to check them for me if I'm worried about anything.
Yeah.
I do have a history of breast cancer in my family.
Okay.
So I generally play it safe. What exactly is a dense breast?
So
Is it a breast that doesn't do well in its exams?
No, it's not.
Sorry, guys. I love you.
So a dense breast is one that contains less fat and more kind of fibrous tissue. It's a variant of normal. Breasts are different for every person. Some of them will have more fatty tissue in, less fibrous and hormonally active cells. Dense breasts generally have more fibrous tissue in there. Now, what that means for you or anyone with dense breasts, it's more common in younger women. It is often more common in those on hormones and that kind of thing. However, what it means is that mammograms can be slightly different. When you have a mammogram, what they look for, if there's any suspicious kind of lesions, they usually show up as white on the scan. Fat tissue generally shows up as darker black or grey tissue. The problem with dense breasts is that density, that all that fibrous tissue also shows up as white. And so looking for a cancer in a scan for someone who has got a dense breast is almost like looking for a snowball in a snowstorm.
That's such a good method. Thank you so much. That's so helpful.
So it is trickier to spot early changes, and the emphasis is on early changes in dense breasts. It's not impossible, and people are really highly trained, and there's lots of AI technology being used now to pick up these changes early. But yes, it is, if I'm being honest, slightly trickier to pick up early changes on dense breasts.
So I've been told by someone who checked because I go for annual checks because of my family history, I've been told I need an MRI.
So it's a really, again, it's a tricky thing because we know, yes, MRIs are better at picking up early cancers in dense breasts. But what they also do is pick up benign lesions. And that could mean women going for biopsies, tests, surgery to check what these benign lesions might be, and they didn't need them at all. And this is the balance you have to strike with these MRIs. There will be women who are very, very high risk who will have MRI scans because they've got dense breasts and they're really incredibly high risk. But overall, mammography and ultrasound scans should be enough with the right people looking at them.
I always find it amazing. I get a letter every year telling me where to be, what time, and I go in and I get my screening. I almost never have to wait and I'm out. And I think it's a real NHS success story.
Yeah. The breast teams up and down the country, I think, in my experience, are really good. And I'm just saying this anecdotally. I think it's because it's run by women.
I'll go with that. I'm going to take that. It's a very well-oiled machine.
It is. We're picking them up early through better technology. So the earlier we pick them up, the better the outcomes are. But also treatment is getting better as well. So the surgery, the chemotherapy, the radiotherapy, all of that is advancing and becoming much more individualized to that person's very specific breast cancer, which has better outcomes.
Isn't that such good news? Let's have a moment for that good news. NHS good news story, rare but joyful. How do you check your breasts?
Okay.
And what should you look out for that should make you book an appointment ASAP?
So the symptoms to look out for, so we'll talk through this before we go through the examination. The most common thing is a lump. Any lump at all, no matter how it feels to you, you should always get checked out. The other symptoms include a rash that looks a bit like eczema around the nipple that isn't settling down with general cream. So if it's been there for 2 weeks or more, it's a rash around your nipple, looks like eczema, get it checked out. Nipple discharge is an interesting one. So the guidance is unilateral, so one-sided nipple discharge. Often that's blood-stained. So that should get checked out as well. Any asymmetry of the breast as well. So if one looks slightly different to the other and it's new, you should get that checked out.
Because one of my boobs is bigger than the other. My mum I was sharing a bathroom with my mum years when I was a teenager, and she noticed that my boobs were a bit of a different size. And she'd sent me to the GP.
Yeah.
Which was the right thing to do,
right
absolutely.
Thing to do. But if it's normal for you, then that's fine. If it's a new change, then that's
I mean, they're not like, massively. It was just a little different. For the record, everyone, just a little different.
No comment. And then remember to look for lumps all the way up to the collarbone and into your armpit as well, because breast tissue extends into both of those areas, and also your lymph nodes in your armpit are really important.
So you should be checking both your breast and the area around your breast.
The only thing I would mention is breast pain. Now, lots of women will come to me with breast pain thinking that they've got breast cancer. Now, it is very unusual for breast pain alone and no other symptoms to be breast cancer. It's more likely to be muscular, hormonal, something like that. I'm not saying it's definitely that, but it's much more likely to be those things. But if you've got breast pain associated with any other symptoms, you should get it checked out. Now, all of this is really difficult to remember. So all I would say is if your breast feels or looks or just your body better than anyone, just is different to normal, go and get it checked.
I get scared sometimes, but it's in your head, go check them.
Yes, the first of every month, check your boobs. So I'm going to talk you through it if that's all right.
Please do a masterclass. I'm ready.
So the first thing to do is just go in front of the mirror and have a look at your breasts. Can you see anything that looks unusual? Anything kind of like a lump that might be sticking out, a change in your skin perhaps? We look at something called puckering of the skin. We call it this really funny name in our medical terms called peau d'orange, which is skin of the orange.
Sounds like
French.
a kind of really cheap scent.
Honestly, I was like, peau d'orange. But the skin of an orange is dimpled, isn't it? So what it means is that breast cancer could be pulling on your skin or muscle tissue, and it can cause your skin to dimple like the skin of an orange, peau d'orange.
I've never heard of that one.
Yeah. So then once you've had a look, making sure everything's symmetrical or not unusual for you, just lift your arms above your head, make sure your breasts are moving symmetrically on both sides, put your arms on your hip, and again, make sure the breasts are moving equally on each side. If there is a cancer in there, it could stop that breast moving in a particular way, or it could cause the skin to pull in and you see something change, like that dimpling thing.
I've never heard that before. That's incredibly useful.
Yeah. Now, you want to feel the breast. Now, there's a couple of ways you can do this, but you want to cover the entire breast tissue. Remember, all the way up to that collarbone or clavicle and all the way into your armpit. I prefer kind of going round in circles, so concentric circles. I would say start at the nipple area. So you want to use the flats of your fingers there. Start at your nipple area and then work your way round, pressing quite firmly. Why are you making those faces?
I don't know. I'm finding this really tough. I'm finding this...
No, fair enough.
Do you know why? I think it's because I've got quite sensitive breasts and I'm nervous about breast cancer. And I think a lot of women, this is quite a scary thing to do.
I get it.
But it's also But the sooner you do it and the more you look after yourself,
Yeah.
if you did find something,
Honestly,
so
the
you
earlier
kind of
the
have to
better.
slightly, it's mind over matter.
And there's a very good chance whatever you find isn't cancer.
How many, if a woman does come to you with something, what's the likelihood?
Generally speaking, women come to me with all sorts of breast symptoms. Generally speaking, about 10% of them will have
So it's
breast
most
cancer.
likely to be
It's most likely not to be
nothing.
anything.
So don't be scared. Don't be like me
Yeah.
and be all scared of it.
Yeah.
Actually, just do it.
Do.
You carry on. So you're going around in
So
concentric
start at the
circles.
nipple, work your way round, all the way round, making sure you're covering and pressing firmly. You're looking for any lumps, bumps, or thickened tissue. Go all the way up to the clavicle and feel all the way that the clavicle is the collarbone, all the way along there, and then down, and then you want to feel into your armpit. So go up, go back, forth, right and left as well.
Okay.
So you're covering all of that area. The other way to do it, which some people do, is divide the breast into 4 quarters and just feel in each quarter that way.
Yeah.
As long as you're covering all the breast tissue into that armpit, up to the collarbone, you've got it done. And of course, do it on both sides. And men do it as well. Men can get breast tissue anywhere in that area. The most common place is under the nipple,
Right.
but it can be anywhere. So men with any lump should go and see the doctor.
I think one of the reasons that I find that so difficult is because I always find something, because I have got really dense breasts, and on particular times of the cycle, they change shape and
Yeah.
they change size, so that's always quite a scary experience. But I know this is called no appointment necessary, and I hope you all right. But I hope this is okay. I always go and see my GP because I find it really nerve-wracking, because it's just not a nice experience.
No. Breast changes are what I would call a red flag symptom. So no matter what time of day that call comes in from a patient, it doesn't matter if I am full or not. If a lady rings up and says she's got a breast symptom, I will ring her back that same day, because I don't want to delay anything. I don't want anything to get lost the next day. So if a lady rings up and says she's got a breast symptom for me, and I ring her back because I don't have any appointments left, I'll say to her, of course, I will see you today and I will examine you. If that lady can feel a lump and I can't feel a lump, it doesn't matter what I feel. She knows her breasts better than I do. I will still do something called a fast track referral, which we would do for anyone that has symptoms that could be cancer, and they get seen within 2 weeks. With the breast team, it's usually quicker, and they will get all the things that they need. Sometimes, if a lady rings up and says, I can feel a breast lump, I will say to her, you know what, I can bring you in and examine you. I can't reassure you because I can't. So if you came in with one of your cysts, I couldn't tell you for sure that is a cyst. I could say it might be a cyst. It feels like a cyst, but I still need to refer you because that's the only definitive way to find out. I will say to her on the phone, you are more than welcome to come in. I will examine you. I can confirm whether there is something that I can feel there or not, but it won't change the outcome of the appointment, which is I will always do that fast track referral for you. If you prefer, you don't have to come in because some women find that examination difficult. I'll still do the referral. The fact that you can feel something is good enough for me.
I mean, can I just thank you on behalf of all the women that you've looked after? I mean, I have to say, I've had a really good experience with my GP. I've had some really bad breast pain in the past, and I get seen so fast.
Yeah.
I think it's definitely NHS doing its wonders.
Yeah, we don't mess around with boobs.
So if you have found a lump and it's not breast cancer, what else could it be?
So if we definitely know it's not breast cancer, and the only way to find that out is through a scan, I wouldn't do that just by feeling it. It could be a cyst, which is really common, a fluid-filled sac, which is non-cancerous. That's a breast cyst.
Yeah.
You can get something called a fibroadenoma, which is just a solid non-cancerous lump in the breast. Again, I would not be able to reassure anyone just by feeling them. Everyone gets referred to the breast team.
Do they need to be removed?
No, they don't have to be removed because they don't turn into cancer. But large cysts and large fibroadenomas can cause pain and they can cause anxiety. So some women will choose with their consultant to have them removed.
I think I've probably had a cyst before and it's just gone.
Yeah, they do
Does that
go
just
away.
happen?
They certainly can go away on their own as well, but some persist. And again, any nipple changes, particularly inverted nipples where they're being pulled in. And again, it's that pulling in that is the issue. Any changes in nipple, get it checked.
So there's quite a few things to look out for. How often should you be doing your breast check?
I always say once a month.
Once a month?
Yes, set an alarm in your phone. The first of every month after you've showered, get in front of that mirror and check your boobs.
Okay, I will, I promise.
Trust me, the earlier these things are found, it's just so much better.
What is a mammogram?
So a mammogram essentially is a type of breast scan that we offer as screening. So what screening is designed to do, so it's offered in the UK to women 50 or above every 3 years. It changes slightly if your risk is higher, particularly if you've got family history, genetics, all of that, then you may need them more frequently. But generally speaking, women age 50 or above every 3 years. It's a type of breast scan. And the whole reason for screening is not necessarily to pick up cancer early, it's to pick up pre-cancer early before it has a chance to develop into cancer, or very early cancer before you develop any symptoms, before you can feel a lump. That is the whole point of mammography, which is why it is so important that you go, because chances are mammography will pick up early cancer changes or early changes before you have any symptoms. And that early is the key thing there. And that's what screening's all about.
Why do some people have mastectomies when they get breast cancer and some people don't?
There's a lot to that question, really. So my mum had breast cancer probably about 10 years ago now, or maybe a little bit more. And it was picked up through mammography. I remember my mum was on Lorraine because breast cancer screening uptake is lower in South Asian women. And my mum is like she's got no filter. And I said to her before she went on Lorraine, I said, please just behave yourself and don't say anything. You know, this is live television. Please don't say anything too spicy. There was no point me saying that. So we were sitting there and Lorraine said to her, why do you think South Asian women don't go to their breast cancer screening at the same rates as Caucasian women? My mum said, because they're stupid. That's what she said. Honestly, she went, why would you not go to something that is free and saves your life? The only reason I can think of is that you are stupid. And because
what did you do?
I just went, but there's also loads of other social reasons they might not go, Mum.
Oh, my God.
Honestly. And I was like, there's lot, you know, they could be busy, they could be carers, they could be really scared, they might not have any transport. And she was like, no, they're stupid. And we had to do like loads of damage control. But to be fair to her, she's an older South Asian woman and she's speaking on behalf of her own.
Right.
You know, and so, you know.
And I suppose there's a kind of kindness to that. It's like, come on.
Yeah.
Come on.
Yes.
You know, we like with me feeling like nervous about checking my breast, there's a point in which you have to go, come on, it's mind over matter. Just go and
it's
do it.
Free. Like, it's such an important free thing that you have. You know, not everyone across the world has the privilege of going for breast screening. So you asked whether someone has a mastectomy or lumpectomy. It all depends on the type of cancer that they have. There's lots of different types of breast cancer. Some of them are more aggressive than others. Some of them are more hormonally active than others. Some of them are more immunologically more active than others. It all depends on the receptors that they have on their surface. Now, some of the less aggressive cancers where we know it hasn't spread beyond that small area can be treated with a lumpectomy.
What's a lumpectomy?
A lumpectomy is just taking out the cancer cells and some healthy tissue around it as well. Some are much bigger, and actually just taking that bit out would be too big an operation, and it might be safer to take the whole breast off because there's a higher chance that it could have spread beyond just that one area. Whether people have chemo or radiotherapy depends on so many different things. It depends on the type of cancer that they have. It depends on the risk of spreading. It also depends on the risk of it coming back in the future. So there's so many different things to bear in mind when it comes to the treatment of breast cancer. I think the best thing to say about breast cancer is that it is very individual. Your treatment and your cancer is very individual to you. And it'll be you, your breast surgeon, and your oncologist who decide together what the best treatment is for you.
But the earlier, the better.
Yeah.
So go to your screenings, check your breasts every single month.
Yeah.
From what age should you start checking your breasts?
I would say it's a tricky one, isn't it, that? It's very unusual for very young girls to get breast cancer, but not impossible. So 18, 20 start.
Even just to get into the habit of it and also become not scared of it.
Yeah. Know what's normal for you and get any abnormalities checked.
Love that. So much I didn't know about how to check your breasts properly. Really useful. Promise I'm going to do it. If anyone has any questions about breasts, any at all that we haven't answered, please let us know. Before we carry on with the rest of this episode, can I tell you about something really special? If you're listening at the start of the year, you might be thinking about moving more, getting healthier, even starting marathon training.
Oh, well, regular exercise, especially something like running, is one of the best things you can do for both your physical and mental health.
If you've got a ballot place in the TCS London Marathon, you can make that even more meaningful by joining the Team Marie Curie.
Marie Curie supports people at the end of life, whatever the illness.
There's no fundraising target. You get brilliant support all the way, and Marie Curie are really with you right to the end.
Yeah, just search Marie Curie London Marathon to find out more.
Right, it's now time for your questions to Dr. Amir with ChatGP. Oh, this is a great question.
Is it?
This is such a good question.
God.
Natalie asks, I keep hearing of women of a certain age talking about how cold water swimming has changed their lives and saunas too. Should we all be freezing ourselves in cold water?
Right. I feel like the cold water brigade are going to come for me here. I really do.
Good luck with it.
And please don't, because I'm only talking about evidence. We don't have any strong evidence to suggest that cold water swimming, specifically cold water swimming, is good for your health overall. Swimming, yes. Movement, fabulous. All of that is great. That feeling you get from doing some cold water swimming, that dopamine hit, the fact that you've done something really incredible, yeah, that happens as well. Long-term health outcomes, not really. You can get the same long-term health outcomes from going for regular swimming in a not-so-cold
What about
pool.
saunas? What about saunas? There's a lot of evidence about...
Sauna is better evidence, yes,
Right.
certainly, in terms of improving cardiovascular health, improving kidney health, because of sweating, because it kind of changes your temperature, your heart rate, your blood pressure over time. There is stronger evidence that saunas are actually good for your health. I'm not saying don't go cold water swimming. I wouldn't do a cold water plunge. There's, that idea that it's reducing inflammation, improving muscle strength and all that stuff. We don't have the evidence to say, yes, it does that.
I'm going to fight you on this one.
Go on.
Brave.
Go on.
Actual qualified doctor. Instagram. So I went on a hen weekend recently and they had a sauna hut and then they had a cold plunge basin, basically. And we did sauna and then we did cold plunge and then we did sauna and we did cold plunge. And it's not something I've ever done before. And I was on a different planet for the rest of the day. I felt so incredible for the whole day.
Anecdotally, yes, lots of people report that. And I would fully support it. You've got to be really mindful that for some people, cold water plunges is actually really dangerous.
Right.
Because it causes your body to go into shock mode. It causes your body to go into heat conservation mode. So all your blood vessels tighten to conserve heat. If you have a heart problem, if you have high blood pressure, that can really tip you over the balance and cause a heart attack. And so, if you're going to be doing that, you have to be relatively healthy. Yeah. I wouldn't recommend anyone do that who has heart problems, increased risk of all of those things. So yeah, anecdotally, yeah, you may well feel better. I've only ever been cold water swimming once. I feel as a brown person, I prefer the heat. It's my ancestral heritage. And yeah, I was waiting for that kind of feel good to kick in. Like I was like, when's this going to happen? I finished ages ago. It did not happen for me.
So it's not for everyone.
Not for everyone, but if it helps you and you feel good, do it as long as you're not harming yourself. We don't have strong evidence for cold water swimming.
But saunas, very interesting and much more pleasant.
Totally.
Sadly, that's all we've got time for on No Appointment Necessary. But before we go, if you've got a ballot place for the TCS London Marathon, don't forget there's a brilliant way to make your run really count.
There really is. Join Team Marie Curie and help bring vital end-of-life care to more people, whatever the illness.
There's no fundraising target and amazing support.
Just search Marie Curie London Marathon to get started. That's it. See you next week, and remember, there's no appointment necessary.